What's up, guys? It's your boy Miguel giving you your daily dose of radiation. Today's video, we're covering X-ray tech versus nurse in the patient outbuilding. So, to give you context, I do X-rays at nighttime, 7 on, 7 off. I work a lot of day shifts, so I dabble in both worlds. So, I know what you're saying, like, Miguel, how do you know about what nurses do? My lady is a nurse, so I've interrogated her many times, and just also based off of what I've seen at the hospital, I have a good amount of knowledge in their world. So, excuse me. So to give you context, the patient outbuilding is usually patients who come for non-emergent like procedures, exams, and stuff like that. Usually it's scheduled. They show up, and it's simple little like stuff, right? So I'll give you the X-ray, and then we'll do the nurse version. Okay. So for the X-ray, usually we'll have some that are scheduled, and we'll have them walk in, just like a urgent care type stuff, like where they just walk in because their doctor said, "Hey, whenever you get a chance, take a chest X-ray. Hey, for your pre-op, show up to the thing and just get a." Usually, most of the time, they're walkie-talkie. Occasionally, patients come in post-op, like stuff been healed, the doctor just wants them to get checked out, or maybe they feel a little discomfort and the doctor's like, "Hey, go to the POB, the patient outbuilding, get some scans done, we have the orders," type deal. So as far as your workload, it can vary based on days, based on holidays, there's various amount of workload. Over there it's kind of all depends. And also they've kind of, what I've seen is majority of your workload comes around lunchtime, because by then most people are done. Because usually what happens is the majority of the patients go to their actual doctor slash nursing like little department, and then they send them off with the order to come to our department, which usually happens around noon, 1 o'clock ish. So our hours of operation over there is just from like 8 to 5:30 ish is the range, versus we can dabble into the nursing side. So the nursing side, and theirs is from like 8, I want to say 8 to 4. Sometimes on certain days it's like 8 to 3:30. And it all depends based off of your physician you work with as a nurse, how many patients they have, what procedures they have, and what calls and stuff. So like your work could vary very much as well over there. And like if your doctor falls behind, you end up falling behind, so the whole thing kind of rolls back. And at the end of the day, the nurses is the one who kind of picks up the slack and maybe has to stay later getting the information, taking calls and stuff, and like being on top of the doctor for the orders, and like it gets very stressful over there. So, and even if your physician's out, then you have to reschedule, and like you have to go and help someone else, and you have to deal with that. So it's kind of like very situational based off of like how your physician is and how what you have going on, and there's a bunch of more teamwork over there to make it through the day. They do get an hour lunch over there with my lady. She would do that, and they would get an hour. Us, you would get supposedly 30 minutes, but if it was busy, you maybe get 5 minutes. So that could vary on stress. The only good part about both of those places is they do close on holidays. Certain days they do close a little bit sooner, and they're not open on the weekends. That would be the plus side of working for both of those. Yeah, it's me, we get. See you on the next one.